I think back to what Dr. Sardi said in early January when I went down there, and he's looking at my scans. And he said, "What is wrong with Canada? Why are they sending people home to die that don't need to die?" He says, "You're a first world country. This is not right." I said, "Dr. Sardi, I couldn't concur more. That's why I'm here."
Lorne Johnson was left to die by Ontario's healthcare system. If he hadn't have left the country to seek treatment abroad, he would not be alive today.
It was early in 21 that I discovered a small hernia on my belly button, and I decided to go to the doctor. I wanted to get the hernia repaired. They sent me for an ultrasound. The ultrasound came back showing some caking on my omentum, which was alarming to the doctors. That sent me to a CT scan in August of 21, followed up by a biopsy in October of 21 to confirm I had rare appendix cancer. They looked at the biopsy and they confirmed to me, yes, indeed, I had the rare appendix cancer, and I probably had 3 to 5 years to live, and I had too much disease to be operated on. Being diagnosed back in October of 21, you have to gently explain to your children, yeah, indeed it's cancer, and it may end up taking my life, but we're going to battle, we'll fight through it. And I'm lucky I have the support. My wife is extremely strong, the best nurse I've ever had by far, amazing.
The only thing that was offered to Lorne following his diagnosis at Princess Margaret Hospital was to do CT scans every 6 months to monitor the cancer as it grew and do occasional debulking to relieve symptoms should they arise. So Lorne went on like this for 2 years until October of 2023, as the healthcare system just allowed his cancer to keep growing. Fortunately, something happened in November that would set him down a different course.
She said, "We'll see you in another 6 months. We'll see you in April of 24, and away I went. That was October. November, lucky for me, I came across an article by Global News, just popped up on my phone in my office one morning. And it said, BC woman receives life-saving surgery in the US for a rare cancer. So I thought, well, let's see how rare it is. It can't be as rare as mine. So I looked at it. It was exactly the same cancer that I had. Alison DeCluzo is her name, out in British Columbia. She had the same diagnosis out in British Columbia. She had the same offering from BC. They wouldn't operate on her, too much disease, go home, plan your affairs. Typical story for me, same as mine. I continued to read it. She ended up finding a surgeon in Baltimore, Dr. Armando Sardi, who looked at her scans, looked at her reports, and said, "We need to operate on you now." And he did, he operated on her. So late November, I reached out to Dr. Sardi's office and explained I have a similar case to Alison DeCluzo. They said, by all means, send your scans down and we'll let Dr. Sardi look at them and we'll go from there. Around the middle of December, I was in Los Angeles for Christmas with my family, and I got an email from Dr. Sardi's office. Saying he could help me. I had a phone call with Dr. Sardi a week before Christmas. He said, "You have a lot of disease, my friend, but I have a lot of experience. I want to operate on you. I feel you should have been operated on 2 years ago, maybe 3 years ago. I want to meet you in person in early January."
2 years before this, the healthcare system in Canada told Lorne that all they could do was watch his cancer grow and try to relieve his symptoms. But why didn't anyone in her system inform Lorne that there are centers of excellence outside of the country that could give him the potentially life-saving surgery that he needed?
Yeah, looking back and what I know now, there's no question I wish Princess Margaret, for whatever reasons they declined to operate on me, be it experience, resources, they should have explained to me there are surgeons out there that may take you on and help you. That was not offered. They did not offer me a second opinion. They should have said, go get a second opinion if you want. Luckily for me, I was able to get a second opinion from Dr. Sardi. A lot of people, they don't get so lucky.
Not having access to alternatives here in Canada and not being informed about options outside of the country almost cost Lorne his life.
After that phone call, we scheduled a meeting in January to meet with Dr. Sardi. I went down to meet him in Baltimore. He explained the same scenario. You have a lot of disease. It's gonna be a long recovery, but this is your best chance at long-term survival. This is the standard of care for your disease. With that, we scheduled surgery for early February. Something you should know, the day after my surgery, Dr. Sardi and Dr. Gushin, who operate on me, they came into my room when my family was present and said, Mr. Johnson, I'm afraid to tell you were on your way out. You wouldn't have made it through the weekend without this surgical intervention. It was timely. That blew me away. Just hearing that, Princess Margaret sent me home to die, and this man saved my life. I had no idea I was in that much trouble. The amount of damage the tumor was causing to my bowel was humongous. They said your bowel was dying. 4 feet of it, they said, was just deteriorated. It was being collapsed. So we took 5 feet out to be safe. Yeah. Does that sound better?
That sounds better.
Me without singing, right? You deserve the deepest of cover. You belong at home by and by. I'm living proof. I'm sitting here today. I'm feeling wonderful. Getting my strength back, getting weight put back on, playing my music. And enjoying every day. I got, more Christmases.
Lorne and his wife Mary Jane had to pay out of pocket for Lorne's surgery in Baltimore, but they are eternally grateful to Dr. Sardi for saving Lorne's life and to Alison DeCluzo, a fellow Canadian, for sharing her story publicly, which led Lorne to get that life-saving surgery himself.
I have a grandson who means the world to me, so to be able to get through this, to see another Christmas with him, see his birthdays, it's worth all the money in the world.
Since Lorne had to travel outside of the country for care, he incurred additional travel expenses such as airfare and hotel. If provinces permitted private clinics and centers of excellence like Mercy Medical to operate here in Canada, then patients like Lorne would not have to leave the country.
Private clinics can be offered to us here in tandem with our public system. It gives patients like me another option to consider. There's definitely a lot of room for change and improvement here in Ontario.
To learn more about healthcare reform, visit secondstreet.org.